meeting today, and the first item on our agenda is a hearing, which we're just gonna postpone for just 1 minute here because there's quite a crowd here. And so I think that we are in a new semester of nursing school. So what we usually do is have everyone introduce yourself and just say where you're from. And so if we can start in the back corner over here, that'd be great.
So I'm Marcy Hanson, and I am the nursing instructor. And these are my amazing students.
Awesome.
I'm Julie, I'm one of the associates.
I'm Chelsea, I'm a student as well.
Can you tell us where you're from?
Oh,
Yeah.
I'm from France.
I'm from North Carolina.
I'm originally from Wisconsin. I'm Arden, and I'm from Kalispell.
I'm Nick, MSU student. I'm originally from Libya.
I'm Andrea, I'm an MSU student originally from Billings.
I'm Tara, I'm an MSU student, and I'm from Dillon.
I'm Lauren, I'm an MSU student originally from Billings.
Justin, MSU student.
Tara, I'm from Hamilton.
Brittany, I'm from Southern California.
I really am from New Jersey.
Cole, I'm from Colin.
Sierra, I'm from Great Falls. Tanya, I'm from Charlotte. I'm from Missoula.
I'm John Firehammer. I'm not a nursing student. From M&R here in town.
I'm Brendan, I'm from Massachusetts originally.
I'm Ashley, MSU student from Missoula.
I'm Adina from South Dakota.
I'm Jasmine from Lindy, Washington. Kristen from Billings. I'm Margaret from Townsend.
I'm Paige from South Dakota.
Allie from Portland.
Awesome, guys. Well, welcome to our meetings today. We have a few things going on that may be of interest. So first up on our agenda is hearing and possible action on the proposed rule change to Missoula City County Health Code Regulation 1 to allow chemical toilets to serve as approved bathroom facilities for picnic shelters and public parks. Gina, okay, awesome.
My name is Gina Miller, and my first name is Jeanna.
Can you minimize that, Gina? And
Oh, you renamed it. Thank you, Julie. Okay, so we are here today to propose a change to the Missoula City County Health Code Regulation 1, which is the regulations for wastewater treatment and disposal systems. And before we get into the specific change, I'll give you a little bit of background about why this has come up now. I know at the August meeting when we asked the board to set the hearing, there were some questions about this is such a specific thing, where is this coming from? So it really is coming out of cooperation between city and county agencies in an effort to get people thorough, accurate permits that isn't going to cause complication down the road. The city building department, as well as the county building department, coordinates their permit approvals with the health department. And I believe it was in July, Dawn Brew just sent me an email and said, here's the plan for New Park. Is everything good to go as far as the health code compliance? And at that point, we started looking into options and looking into their proposal, and turns out what they were proposing actually was not in compliance with the health code. And we'll get into why. But at that point, we met with Parks and Rec staff, and sanitarians had several discussions, and we talked a little bit with city building about the proposal. We considered alternatives that were allowed under the rule, and then we considered, well, is this appropriate for a variance to bring to the health board, or should we just change the rules? So ultimately, we decided the best way to go for this one probably was just a rule change. Is this the right button? Okay. Okay, so the current language in the health code, Regulation 1, Section 14C, has to do with chemical toilets. And it's probably important to note that when I say chemical toilets, there's a lot of different terms that are used. So you'll hear porta potty or portalet or porta john. It's all the same thing. But in the health code, we call them chemical toilets. And it's what you think of set up at festivals, the plastic shelters with kind of the blue deodorizer liquid in the toilet. So in the health code currently, we allow chemical toilet use for temporary events, construction sites, and other locations where a permanent system isn't required. But we limit the use of chemical toilets by prohibiting them to serve as the approved toilet facility at a structure. It can't be the permanent sewer system for a structure. Structure is then defined, and it's really broad. As you can see there, it's basically anything that's built, constructed, joined together, and there's a reason for that. Having a really broad definition of structure has served us well in the past. It allows us to apply the rule in all of the places where it should be applied, so that we have permanent restroom facilities where they're needed. To define it in other ways might inadvertently limit it and leave things out of the definition of structure, and then by way not require permanent bathroom facilities. So there's a reason it's so broad, and we like it, and it's worked in the past. So what's the purpose of requiring permanent sewer systems or bathroom facilities at structures? It's clearly to keep areas clean and free of human waste. So we want to identify places where people are likely to gather. So where you live, where you work, where you play, where people congregate. And there's a lot of places like that in Missoula County because we're fortunate enough to have a lot of nice facilities. I think everyone agree it's important to have bathrooms there. So the reason that we don't allow chemical toilets to serve structures in those kind of areas typically is because there's a financial burden that sometimes people don't necessarily think about or fully consider up front when they want to have long-term use of a chemical toilet. They're not permanent, so you can't guarantee they're going to be there all the time, and they need ongoing maintenance to prevent contact with human waste and just to keep them aesthetically acceptable. So the proposed language change is pretty small, meaning that we're not changing anything from section 14C, but we're adding at the end of it kind of a clause that allows a limited expansion of the use of chemical toilets. So they may be used as the approved toilet facility for picnic shelters in parks owned or operated by the city or county. So it's pretty specific. It's not a broad expansion of the use of chemical toilets. And the reason that we feel that the language change is appropriate, the reason we're comfortable coming to you today with this proposal, is because the more we talked about it, meeting with parks, talking with sanitarians, looking at the facilities we have in Missoula, we realized that parks are unique. They don't have a lot of the same concerns that we would have at other facilities or on other properties, so it's less concerned about an ongoing financial burden with a city or county-owned park. They generally have a budget and they can plan for those kind of things. One of the most compelling reasons that we're proposing this change is because chemical toilets in parks actually end up being more available than a permanent facility like a flush toilet. And the reason for that, which I'm sure, great, Donna's here. Donna will be able to speak to is they're limited on how often those can be open or available, both by weather. So if it's a flush toilet, it's really hard to keep those going heated during the winter. And they're also locked for good reasons fairly often to prevent some of the bad behaviors or risky behaviors that can happen in a permanent structure that's left unlocked all the time in a public place. Also, when they are damaged, if they are damaged through vandalism or from other reasons like giant trees falling on them, which has happened, it's a lot quicker to repair or replace it, rather than, if you have your flush toilet vandalized, it's very expensive, it's hard to coordinate those repairs, but with a chemical toilet, you just swap it out. The last reason I'm just going to briefly touch upon is crime prevention through environmental design, or Sept. Again, this is sort of Donna's wheelhouse. But it's really about designing public spaces so that they're open and inviting, and the potential for crime is mitigated by a few principles that really make a lot of sense when you think about them, but the way that it's implemented on the ground and in our parks is really interesting to me. But it's about seeing things and being seen, having a sense of ownership and comfort and community use, and diligent maintenance and repair. And so chemical toilets fit into that design a lot better than, you know, a concrete vault toilet or a flush toilet. And John will speak more about that. But kind of beyond just the Regulation 1 change that we're proposing, having people using our parks and using our open space really is consistent with the goals of the health department. And if there's a way to get people out in parks, have them there, have them comfortable and happy and recreating, and also have access to a toilet, it kind of goes hand in hand. So this is the timeline, most of it since we last spoke, well, I guess half of it. So on August 14th, I presented the proposed change to the Water Quality Advisory Council. And we didn't receive any suggestions for changes or feedback really from that. They were generally very supportive of the change. And then last month on the 16th, we requested the board set this hearing. And then on the 7th, we posted notice of the hearing to our website, and we also emailed it out to our interested parties list. And it was noticed in the Missoulian on the 9th and the 16th. And to date, we have not received public comment. And so this is just a slide that has a proposed change again, and that's really all I have. It's sort of a small change, but I'm happy to answer any questions you may have of me.
So I do have a question. This is more in reference to our houseless population. So if we pursue any avenues where we have tiny villages or what we consider soft-sided tents, is what they call them in other cities, the preferred method are porta potties. They are not having permanent flush type structures. That would be prohibited by this ordinance. So how, obviously we've had a situation where we've exempted someone from this already. Would there be a situation, well, we gave a reprieve to a previous candidate that came before the board with porta potties recently?
That was a waiver.
That's a
waiver.
variance,
Variance.
a form of variance.
So would there be any situation where,
I'm sorry.
that we could exempt, if we did put up a tiny village or something of that sort? We have a tiny village going up right now that I think may have some porta potties in place during construction until they get it settled.
And of course, during construction is fine, because that's right in the allowed use. You know, we'd probably just have to look at that proposal separately and evaluate it. But you're right, with a permanent, regularly occupied structure, right now the health code requires that they have permanent bathroom facilities and excludes them from using chemical toilets to serve that purpose.
And the only reason I bring this up is I've actually traveled to a few of these, and their best practices, they have decided not having flush toilets is the best idea. They do have plumbing and showers, but they don't have flush toilets. And porta potties are the way to go there. And it's just due to the population that lives those types of things. So
It may be another instance that we look at in the future, but it's definitely a applicable question.
thank you.
I have a question, and it might not be up your alley, but do you have an idea about the capital cost difference between a flush toilet construction and the operation and maintenance cost of chemical toilets on an ongoing basis?
You were just right that that's not up my alley, but I know somebody that can answer that
Okay.
question. I think Donna has some information to share as well, or sure, maybe it's
Okay,
appropriate
yeah,
for
great.
Donna to
Yep.
share her stuff.
Thank you. My name is Donna Gockler. I'm the Director of City of Missoula Parks and Recreation. Gockler is G-A-U-K-L-E-R. And thank you for hearing this item. I've been working in Parks and Recreation for a really long time, over 30 years, quite frankly, and we spend an inordinate amount of time trying to figure out how to best provide designs that cause the greatest amount of play, interest, physical activity, social interaction in a positive way possible. And one of the guidelines that we adhere to very closely is Sept. It's a series of guidelines to prevent crime through what we call a three-legged stool. The first is design. Really great design is often way over half the battle. creating space where there's a lot of natural surveillance. It's clear what the use and the purpose and the intention is, that the area is designed for the desired behavior. All those things, it's easy to maintain, it's easy to keep clean, it feels clean, it feels safe when I go there. The second part of that leg is really good maintenance. So we try and create facilities from the ground up that can be readily maintained, because we know that when places look neat and clean, well maintained, they're less likely to get vandalized and less crime occurs there. And then the third one is enforcement. And that is literally things like police enforcement. And we can greatly enhance their ability to enforce by how we design. So they can, even on a drive-by, see the entire park. So if you think about it from a parent's perspective, which this happens frequently, and quite frankly, less with picnic shelters and more with things like playgrounds and playing fields, where that restroom sits, what its intended use is. We all know the intended use of a restroom, but believe me, there are a number of uses. How I can see the door, where the restroom is placed, so can somebody else see what my kid is doing when I'm with this child at the spray deck, and my other child runs to the restroom. We're looking at all those things. Which way does the door open? Which way does it face? Can the parents see them from across the park? What we've learned through experience, and we have multiple restrooms in the park system. We have what you call group or gang toilets, and most of you are familiar with those. Those are what most of us grew up with. You open the door, there's a row of toilets and a row of stalls. We're going almost completely away from those except for events. So we have built one new restroom like that at Fort Missoula Regional Park. We only open it when we have staff on site. We can inspect it, we walk through it regularly, of course proper gender walking through it, but we've even designed that restroom so that the washrooms and the entries are shared by men and women, because we know that when males and females share the same space, it enhances their behaviors. Then they separate and they go into their stalls. We have individual restrooms that are flush, and those are in our larger community parks. And then we have portalets, and we use portalets a lot. We know that through the last 3 statistically valid surveys we've done with citizens, there's 2 primary reasons citizens don't visit parks more often and or stay longer. 2 of them are directly related to work we do with the health department, and it's managing dogs off leash and dog waste. And the second is having restrooms available that I'm comfortable going into. What we've learned with portalet shelters, and Julie just referenced, is a big part of design is designing for intent, and that intent of use is absolutely clear. And so a portalet does not allow the space or the comfort or the temperature or the water that makes it a desirable place to habitate. I do not want to live in that space. We even tried vault toilets in one of our community parks, and we thought that would address all of the issues a portalet does, but better meet the health code because we care about health as well. But what that space turned into, and we ended up having to lock it up in the winter, is a heated bathroom. Unfortunately, it was heated by bringing wood and newspapers into the bathroom and lighting a fire on the inside, which destroys our buildings. What we do with portalet facilities is we set them on hardscape, generally concrete, sometimes cushion or gravel material that's been compacted. We stake them in place in almost all locations with all our new facilities. We actually build a little metal structure with a roof around them. We have learned that they get torched to us. The little bit of vandalism we've had with portalets have all been Molotov cocktails thrown into the toilet. We've learned that we have to keep them a certain distance from other structures that could burn. They disappear in about 15 minutes before they're gone before the fighter can put them out. But there's nobody that was left in them. That was an intentional act of vandalism. They can be moved away with a front end loader and replaced within 4 hours. so we still have a bathroom. We can leave the restrooms open 24/7. They do not get vandalized or tipped over. You'd be shocked how little they are vandalized or pushed over. Because of their small space, we're not observing as much needle exchange. Two people don't fit in them well. I mean, you know this. It's not very comfortable. You know that you want in and you want out. I do have some pictures and I might need a driver.
If you hit escape,
Thank you.
and
How
then,
do they meet the ADA requirement?
There are specific portalets that come with Americans with Disabilities. Just looking for one of the handouts I provided.
if you want to minimize the PowerPoint,
Okay. I have some pictures of bathrooms, which I know you all are excited about.
your pictures are in,
No,
it's
back
the
up.
second row of the PDF. To your
Right in the
left.
middle.
In the middle.
Right in the
This
middle.
one?
Yeah.
Okay, thank you. So this is a, so yes, portalets come as either individual single or you can order one that meets the Americans with Disabilities Act, so they can be accessible. Those are a little bit larger, but still not very desirable to be in. This is a typical vault toilet, and you'll see that Parks has some of these at Fort Missoula. You see these all over on state parks, fishing, river access sites, and national forest. What Parks does with ours, though, is we'll do a portalet, don't pay attention to the design, whether it's wood or rock or whatever, but we won't even put a shield in front. What we're trying to do, I would never put something that went floor to ceiling in any city park. What we're trying to do is make sure there is no room to hide, change clothes, or hang out. So your bathroom would look more like what you see here. Even when we build new restrooms, we're building them as unisex, all function. What that means is urinal, toilet, baby change station, sometimes even a top dock. And so when I open the door, I can survey the entire room and determine if I actually want to use that facility. When we have multiple of those, which is a goal that we actually have for Karis Park, because they have the old gang toilets, and what I really want them to have is individual. If one bathroom goes bad, we can lock that until it gets repaired, and now there's other bathrooms. I can open the bathroom door, survey the scene, determine it's safe for me and my kid or whoever's going in, and then when I leave, the next person can do the same. So it's the safest situation. A portalet basically provides that. One of the things we don't want, this looks a little bit more like what we're used to with the old gang toilet style, and this is almost what they always look like. And so when people go out to lunch and they say, why is the bathroom a mess? We might have cleaned it 15 minutes ago. It only takes 15 minutes for somebody to mess up a restroom. And this does not feel, especially if I'm alone, when I'm at a big event, this feels perfectly fine because there's people coming and going. But if I'm all by myself at 10 o'clock at night, I kind of tiptoe in there, right, and listen. And so what we're trying to do is get away from that. And this is a portalet. This is what we're going to try and provide the service. Because face it, when you have to use a restroom, and especially at the youngest age, and as we age, that's when the bathroom becomes the most urgent. And we use them more frequently. And if the bathroom's not there, we either choose not to go to that place or we choose to leave. And if our ultimate goal is to encourage people to be healthy and active outdoors and meet their neighbors and engage in society, I hate to say it, but this does the job. From a cost perspective, there is an ongoing cost, but so is there to build a bathroom. So to build a single restroom, vault toilet would be about $80,000. Flush toilet, assuming the utilities are there, is about $125,000. Could be $200,000 if they're not. In some cases, it's unrealistic. At Fort Missoula, we ended up installing a vault instead of a flush in one location because it would have been about $500,000 to run the lines because the utilities were so far away. And then if you look at cleaning it, yes, we do have park employees who can clean it, but this is $85 a month. So if you did the math really quickly, even at minimum wage with a daily visit, or even a twice a week visit, that part's pretty much a wash.
Is the intent that the units are rented, or will the parks be buying them?
We rent, we do a request for qualifications and proposals, and so it's good for local business in that way. The waste goes to the wastewater treatment plant, and they do have the space, because obviously that's where our waste goes when we flush it too.
Does the company you rent from then also do the hose down once a week or something?
They do, and then we can contract with them. The $85 a month to $95 would be probably twice a week cleaning, and then we can do, in some locations we only do once because it's a more remote site, it doesn't get used or vandalized in any way, even messed. And in other cases, we may order in extra when it's a large event, or have them cleaned more frequently.
Any other questions? No? Julie?
Maybe we should talk about budget another time about this, but, so if the bathrooms we have are undesirable because we know what's going on in there, is there any way to repurpose those? Like for, I don't know, storage space, or, I have no idea, just
Yes.
rent them out for special occasions, if somebody's renting the park, I don't know.
So what we do with current restrooms that are in targeted sites, so one of the key things related to Sept and crime prevention through environmental design is a lot about crime has to do with along the path. So the location of crime can change frequently. We once lost a restroom 3 times over in Pineview Park in one summer, but the 20 years before that and the 10 years since it, we haven't lost one. So once we caught the person, so in those situations, we've done a variety of things. There was one restroom in one neighborhood in town where a police officer actually agreed to hide overnight, and we caught them. We have repurposed some to storage, and in some locations, we close for the winter, but we hire security services. And we either do random locks and checks, or we do evening regular locks and checks, and that works as well. So yeah, bathrooms
See,
are
if we're
both
not
sides.
paying people to lock them up all the time, because I know what it costs you per hour, and by the way, Donna charts out every single moment and minute of the employee's time and what they're doing. It might be cheaper just to go with all porta potties and not even use half the restrooms we have.
In some locations, yes. Neighborhood parks are pretty good for this, depending on their volume of use. Spray decks, we like to have, if we can, a flush toilet. Just because the number of baby changes and stuff like that.
Okay, thank you, Donna.
I'll just add, I'm sorry that I didn't put a slide up with the proposed motion, so.
We have another.
Okay, we got it. We got
Okay,
it.
good.
Do we have any other public comments on the presentation of the hearing? None?
I'll put the motion on the floor.
Okay. Any others, board or staff comments on the motion? Julie?
Just that we don't know when you would actually like the regulation to go into effect.
Today.
Immediate?
Effective immediately, right?
Not for the health care. That's for ordinance. It could go into effect.
Okay, yeah, and that's agreeable with Julie, I assume, yes.
If that's the intention of this motion, for it to be in effect immediately, yes,
Okay. Ready for the vote? All those in favor, signal with aye.
Aye.
Opposed? Motion carries.
Thank you.
Thank you. There's no end to the things that Donna knows about.
Thank you.
Next up on the agenda is approved community's letter of support, which includes Board of Health for point of sale regulation of flavored smoking and vaping products. And Lisa? You're up.
I see it. The video.
Okay, am I there?
Yep.
Hi, I'm Lisa Paskevich. BECZKIEWICZ. Health Promotion Supervisor. Thank you for having me today. I'm here to share a little presentation about point of sale and then talk about the sign-on letter. So this is a pilot project that's being conducted between MTOP, which is Montana Tobacco Use Prevention Program, and M&R Consultants here in Missoula, and community partners, and we are one of those community partners. And Kayla Warren and I put together this presentation with our friends from Lewis and Clark County for our health department. So, point of sale. This is your point of sale when you walk into some establishments in our community, and the point of sale is nicotine-based and tobacco flavored with an essence of candy. And this is sometimes behind the counter and sometimes in front of the counter. So it's a wall. And the outlets that we see this in are convenience stores, gas stations, grocery stores, supermarkets, pharmacies, which are conveniently located in neighborhoods and by schools and parks and where people live, work, and play and go to school. So the point of sale is where you are going to go purchase your bottled water, your tobacco products, your chips. And so why do we care about point of sale? Because Big Tobacco is really targeting our kids with this product. And what we know about this product is that it's, as you can see, is she holding candy or is that a nicotine product? I don't know, but I'm pretty sure it's a nicotine product. But she might not know that. She looks about 7. So how do they discern when their brains aren't developed and they're very young? So. And we know for a fact that 9 out of 10 of our adult smokers start before they are the age of 18. So they're really targeting the new generation of smokers.
Since the old ones are dying off.
Yep. Totally. So we know Big Tobacco targets current users, former users, would-be users, and kids. And so really this is fishing for the next generation of smokers, and we know how addictive nicotine can be. And what you'll notice when you go into all of these point of sale establishments is that their product placement is pretty genius, that they are eye level. If you look at, see where counters are, we have to bend over as taller adults, but very much it's at the eye level of a young child. So we need to be really cognizant of what that looks like in our community. And they're brilliant. They're packed with flavor, cherry. I don't know if any of you have experienced the look, the feel of the up-and-coming tobacco products and e-cigarettes, but I will just share a personal story of going to a concert. Behind me, there's an older gentleman smoking a cigarette that really, really stinks and it's getting my hair and really annoying me. And then in front of me, there's some young people smoking e-cigarettes that smell like cherries. So it's very interesting, the contrast of generations, and to feel that in our community right now is really powerful. It's happening. So Big Tobacco is brilliant at putting together some numbers and spend a lot of money on marketing and targeting the age groups. So about 3,300 youth under the age of 18 try their first cigarette. 700 of these children will become regular smokers. There is nicotine in all of these products. They are not nicotine free. So a lot of money is spent on these products. And how it works is that the convenience stores get money for where they put their product placement of their cigarettes and e-cigarettes. And then what we know that a lot of money is spent, we know that tobacco prevention is one of the most preventable behavioral health, poor health outcomes out there that we can prevent. It's number one. It's been number one for a really, really long time. And so we need to know that the real cost is that still chronic disease is happening at really high rates because of this So, if you ask kids who does it help hurt in our community, it normalizes the presence of tobacco products, and it encourages kids to get the product, to use it, to get hooked. It's exciting, it's exhilarating, it's attractive. And so marketing works, and so we're trying to counter that with public health right now and looking at policies to make that happen. And we want to make it harder for people young people not to have access to this product. So the recommendation that I present to you today is to approve, oh my goodness, I can't read that.
You could read it.
Okay, that'd be
Approve
great.
inclusion of the Board of Health as a sender or a signer to the Community Health Letter of Support for point-of-sale regulation of flavored smoking and vaping products. And you have in your packet the community letter that many other parties have signed. That's what we're asking. We're not bringing a separate resolution or action, simply to add the force of your name to that community letter.
As a community partner.
You're adding your name, you're not being asked to literally sign the document.
Right.
And in signing the document, the future action where this letter is going to be going is to a resolution to the city council that prohibits self-serve displays of all tobacco and nicotine products in retail establishments, and it prohibits the sale of flavored tobacco products or nicotine delivery products in retail establishments in which minors are allowed, including menthol. And also, you received today a letter from Amanda Cahill with the American Heart Association, who could not attend the meeting today, but she wanted to share that the Heart Association strongly supports the point of sale resolution and the sign-on letter, and so I want to encourage you to add your name.
And I'm guessing that the county doesn't have the authority to do a resolution to do that in establishments outside city limits.
You actually, I believe we're talking about an ordinance, a city ordinance, actually not a resolution.
Okay.
They may start with a resolution, but I can't really speak for the city council or any member of it on that, but they do have ordinance power. You, of course, have resolution power, not ordinance power, and I don't know if you have powers in this.
And then the city has the extraterritorial powers of the 5 miles outside city limits, which would be in the county for some things. I would imagine for this, though, that would apply.
I don't know.
We did ordinance.
And we're just going to look
We're
at
just looking
Anna until she says something.
Well, we've seen that in other counties, there's some legal challenges to amendments of the health code to address smoking-related regulation. I don't have an answer for you whether it's you have a countywide power to do that.
But I think an interesting way that we could maybe reach some people in the county anyway would be to put it in some sort of a article format so that the county's community planning office could add it to their newsletter that they send out, because that gets to all our rural areas. It has a pretty good following. It's electronic.
There's always the option, if you wanted to try to pursue legislation in the next session to clarify that this is an explosive power that counties have.
Especially now that the information on vaping has come out.
Yeah, the FDA was it last week that declared that this is a public health crisis. So
I have some questions.
So we're in it.
About the second possible resolution. I'd like you to explain how that works when somebody goes and gets gas. The kids go in to get a Coke. I mean, to me, this has to be thought through so completely. We have to have answers to every single question because there's going to be major pushback on that.
John?
I can speak to that.
Yeah.
You'll have to speak up here, please.
Sure. My name is John Firehammer. I'm a consultant with M&R Strategic Services here in town. We're a firm that has a long history working with the Tobacco Prevention Office at the state. And so in my work with the folks in Helena, we have over many months crafted a model ordinance that could be used by a city, any city in Montana. That's squared against Montana code with, you know, potential for a lot of things are preempted, what you can and can't do under Montana law. But the model resolution that has been developed, it prohibits self-serve access to tobacco and nicotine displays in stores. So right now, it depends where you go. Some stores have everything behind the counter and you have to ask for everything. You go in some places and there's freestanding displays of smokeless tobacco and the flavored cigarillos and stuff, and they come in, you know, grape and cherry flavors, and they have corresponding color packages that they look like candy, many of them, and they're intriguing to kids, and they kind of send a message that, you know, normalize the message about tobacco. So that's one piece. The other piece would be eliminating flavored products. And so your question is, you know, how do you do that? Prohibiting flavored products in retail establishments that are open to minors. So flavors are not protected under Montana law. There's no preemption there. So under the model ordinance, you could eliminate flavors from, say, gas stations and, you know, the places where kids go for gum and candy after school and on the weekends and hanging out. So that's
So I guess my question is far more specific than that. So what are the options? Can they prohibit minors from coming into their establishment? Can they put a sign up saying no minors allowed? Would that work under this ordinance?
Mm-hmm.
Would this I guess I just need to see what the proposed before I even pitch this.
Mm-hmm.
Right, with the city council, that's
Right.
what happened at your level.
Yeah.
And the letter is not specific to the model ordinance. It's asking for the city to investigate the issue and take action on it.
If it clarifies at all, I recognize that you, having very recently been through the tobacco ordinance, we know that started with the health board and then was restarted with the health board and the extraterritorial powers and everything. This is a breaking newer ground. It's starting with different players among the group of players that usually advocates against allowing access to tobacco to kids. And it's not starting with any particular ordinance such as we brought to you last time and took to the city council. So it's an earlier introduction in the process to the health board than where we were last time. And I realize that might feel real different to you, but there's different players taking the lead, and we're earlier in what is a newer process to us. Smoking ordinances are, they've been around for a while. These are relatively newer.
And I'm happy to sign the letter if you take out inconvenience stores. So if it just says taking action to protect kids from being targeted with such products is an important way to prevent them from being addicted to nicotine and turning and da-da-da. If you just, because that's targeting very specific business owners in our community unfairly who we don't know what their stance is on this.
So you're looking at the Heart Association one. So this is the letter, is the sign-on letter.
The sign-on letter is mostly signatures and citations, and about a page and a half of info.
There's a lot of statistics in it.
And there is several references to convenience.
There are references. The other thing to, as you're looking for that, something to consider is some of you have a couple different roles in the process, and you, Julie, on City Council will have the role of shaping right down to specific what does belong, what is pragmatic, and what isn't. At this point, the letter is, yes, it does mention convenience stores. It's much more getting community support for addressing the issue. I know Dr. Stenger isn't here. He did not specifically ask me to speak for him today, but when the notion of all of this coming up was first talked about several months ago, Dr. Stenger, as a member of this board, was one of the individuals in the community who was contacted by those that are leading this effort. And he did reach out to me and say that as a member of the health board, he thought it was important that the health board address this issue.
Jean?
And the health boards and the staff at the health department have been proactive in products, in informing the public on products that were tobacco going after kids for a long time. We identified and produced that brochure some time ago that showed all these things that looked like Tic Tacs and the little Listerine thing you can melt so you have good breath. Only these were full of, and a lot of these products, if kids get their hands on them, I mean, if a kid takes a product that tastes good, they can easily take too much and it can be fatal. So I'd just give another example of how Montana has been proactive in products that weren't appropriate for children but targeted towards children. So when wine coolers first came out, which I don't even know if they sell them anymore because they changed all the product lines, but when wine coolers first came out, they put them in 2-liter bottles. And so you had an orange flavored wine cooler, and their product placement was in the line where you sold soda pop. And so kids were convincing their parents, well, it's in the pop aisle. And so the Montana Association of County, or Montana PTA, which I've changed roles here, but I was the lobbyist for the Montana PTA at the time, had a resolution at the state level, it went to the national level, and you do not see wine coolers in the United States in 2-liter bottles anymore. So we can make a difference, starting with the local.
Yes.
And of course, the tobacco industry is really interested in this, because as you probably had your mailbox inundated with things from the tobacco industry recently, they're looking at their bottom line. So Julie, you're gonna get to carry a lot of the water, but I'm happy to help.
Yeah, I may just change some of the wording on this. If the goal is to have it well received and passed, we can't specifically target anything. I don't know whether we change convenience stores to quick stop stores, or I don't know. I'll think about it, but.
So the reason they're targeted though is that's the ones that get paid for placement.
But News is News and always a pretty good community partner here, and to single them out and say, you're the problem, that's.
Not if they don't put them out there.
So
There's
what?
Solution too.
So what this board can't do is change this letter. This board could.
Can they lock them up the same way they do cigarettes? What are the options here? What are
There's on the pragmatic level, there's many things that could be done that I'm sure the city council in open session and public hearings and open committee hearings will discuss, and we'll hear from all of us, including different types of convenience stores. Right now, I don't even know how any one person would define convenience store. I think we're simply looking for a noun. I mean, we thought we could define vape shops, and that we learned that, once you get into those details, which you will need to do if this comes to the city council. We did not prepare a separate letter or anticipate addressing things like definitions of terms for the stage we are in the process, but I do recognize you're going to be in that stage next. The good side to that is you will be sitting in the seat that can work with those legal definitions and how you pragmatically address them, and we'll hear from various vendors.
Well, have we invited them to do any, I think the best thing to do is to invite them to the table and have a meeting
Before your ordinance, sure.
Right.
Yeah, oh, the city council can absolutely do that, and our staff will, you know, as usual, be involved with helping the city council on all of that. I think the difference here is this department staff isn't crafting the ordinance, and so we did not bring specific pragmatic definitions of terms or a legal ordinance to you, but that will come to you if the city council, by looking at this letter, chooses to go forward in some fashion. So this is asking the city council to go forward.
Is there a reason why this is strategically being, this hot potato is out there before the election? Or could this go into effect after?
How's it gonna impact the election?
There's a lot of legislators who are gonna be really upset about this.
Their names are on. They signed it. Diane Sand's name's on here.
Yeah.
They signed it.
I will say that I did ask MTUB to give us time to get our other work completed with the city council. Certainly, they've been, you know, looking at this for a while.
I saw another one. I thought maybe
Yeah,
it was
Senator
Olson.
Tom Facey, Andrea Olson.
And they're probably still gathering more names.
I don't know if they're up for reelection. I know Diane is, but
Yeah.
just one of those things to consider.
Yeah, well, you do have two hats, and I think some of the questions you're raising will come into play with city council.
So Lisa or John, is the, do like grocery stores usually not sell all this flavored stuff?
They do, I think.
It
I was just
varies,
wondering.
you know, I think grocery stores, I've noticed tend to have, you know, sort of what they call the courtesy counters. It's usually, I don't see many that have products out,
Right.
like self-serve access to products. I think it's mainly cigarettes, but yeah, it varies.
So I mean, if best practices say that it's okay, they can have these things and allow minors in their store if they are locked up or in a locked case, is that a best practice? Or, I mean, because then
I think it's just not self-serve.
well, but the second part of that is not saying prohibits the
Yeah.
sale anywhere where minors are allowed. And so
But
that's.
That's just a general thing.
Just examples.
It's a possible action.
Well,
It's not set in stone.
It's a model ordinance that MTEP has, you know, with the tobacco use prevention program, has developed a model ordinance which could be adapted by local municipality, you know, but, I mean, the model ordinance, it suggests removing flavored products entirely because they're used as a way to advertise using tobacco nicotine to young people. You know, it's very deliberate, the way they're displayed and the way they're packaged. You know, they look like candy with candy colors.
But
that
Lisa,
also
there's,
gives-
this letter has no reference to this resolution,
No.
right?
No, it
This
doesn't.
is simply
It's
just very non-specific.
just
Please
a
take
simple
action.
possible.
consideration
I-
that's an issue here that needs to be addressed.
And
Yeah.
I just wanted to let you guys know where it's going, what the pipeline is.
Right, but
So-
what's the timing on trying to propose?
Well,
It'd be long after the
That's
election.
gonna be ideal.
the timing is,
I mean, we would send this letter to the council.
It's not even.
The council's gonna have it as correspondence. It's gonna get referred to one of your committees probably.
Public safety.
right.
So, you know, this is just the Board of Health saying, we think this issue is important enough for the city to consider resolution.
Correct.
Yeah, and you could also, if you're having any concern, because while I understand you wear two hats, you also don't want one hat saying one thing and then the other hat saying another thing, but there's also the abstention option if,
Oh, yeah, no, I would never do that, but I mean, it's just
Okay.
if we do go down this line of, I don't know, the second part of this is born with pitfalls, because if 5, prohibit the sale of flavored products in convenience stores, and that gives an unfair advantage to all the vape shops.
But that isn't something that this letter is asking us to do.
I know, but it's
So-
all part and parcel, it's all tied
Yeah.
together. And like she said, when you say you're on board with one thing, you kind of
Right.
have to stay consistent.
Right.
And-
Yeah, this is just really early in the process.
And it is a little awkward because it's a letter to yourself.
Yeah.
Which I'm on the top of it, but I'm not on the health
Right.
board at the end, which is odd too.
Oh,
Oh.
so was that purposeful?
I think so.
What?
I think because
So
it's
she's
not-
just-
not
Julie's not listed down below, and is that because
I
the
think
letter's?
it's 'cause
No,
I'm- 'cause I-
that's a
oh.
mistake.
Well, I figured it's because I'm in the top,
In the
but
top.
anyway,
Okay.
That's not, no, that's
That's an error.
That's an error.
I still
Apologize.
have some issue with calling out convenience stores directly, but
But I think that's where it mostly happens, that's why. And it's just, to me, it's no different than the alcohol sales and you know, when we send somebody in to see if they can buy alcohol, minimum wage, all that stuff. The places that have good management pass. They get good
Compliance
grades.
checks.
Compliance checks, thank you.
So, I mean, there certainly are some options here. I mean, we could draft our own letter that, I mean, does this have more weight because it has all these signatures? Is that what we're going for?
well, yeah.
Yes,
Yes.
okay.
Correct.
Yeah, I mean,
You
I'm
are
just
one
trying
of
to
many.
see.
If you did that, you would, another option is that we don't list names on here. I realize your names have a lot of power, so I don't want to take them off, but you can just say that, you know, you as the board, and the board is by majority rule, that the Missoula City County Board of Health is on this letter. If you draft a separate letter, which you certainly could do, you would be missing on this letter, so that would be some, you know, picture to consider. I would not like to see the health board missing on this letter that's very largely supported in the community.
Or perhaps Debbie could just have her signature as, or Ross could have his signature as chair of the health board on behalf
Yeah.
of the Board of Health or something like that. 'Cause I guess since we're not signing it, it's really just what
Right.
the statement of the board is.
I believe it should be the Missoula City County Board of Health by a majority vote, because the board has to act as a board, not an individual, and it isn't a signature, but that's just, I mean, for me, this goes back to the early days, long, long ago, when we first started addressing just plain old tobacco ordinances. This is exactly the method that we used to get started. We just started with letters of community support that different people signed on, and we went from there. So it doesn't look that unusual to me, but that, of course, was a long time ago.
Since it's not our letter and it's just a sign on, I don't think that we need to wordsmith it, but you can definitely
Well-
wordsmith it when you get to your,
I was just
Committee.
gonna say, in the first paragraph where it says in convenience stores, I would just take out around Missoula and just say in convenience stores across Montana, tobacco products. And then in the second paragraph where it says it's important that Missoula also take these steps, I would just take out that sentence. And just say we as a community can protect our kids.
but this isn't our letter.
This isn't
We
your
can't
letter.
change this letter.
We're just signing on.
This isn't,
I respectfully request that we either support the letter or not support the letter, or write another letter or not. And my recommendation would be to support the letter.
So the one place we have control is at the very top where it says the City of Missoula. We could take out convenience stores there if you want.
Well, that's not our letter, and we can't.
But this is just I don't know. There is that part of it too. That's part
We
of it.
can't, we've got
Yeah, who wrote this?
we have 3 full pages of signatories here.
Cancer Society Law Association, Heart Association,
So it's Kristen.
Madam Chair, I would move that we sign on as the Missoula City County Board of Health.
If it's majority vote, it is
Public
the board.
comments on the motion on the floor?
I missed the motion.
Done?
To sign on as the City County Board of Health And we
No
can
names.
decide whether we want everybody's name or
Okay.
not. I'm fine with my name. Would you prefer not to have your name?
That's cool.
And with our names listed.
So your motion did include names? Did.
Any other staff or board comments on the motion? All those in favor of the motion signal with aye.
Aye.
Aye. All opposed, same sign. Motion carries.
Thank you very kindly.
It's with names.
With, June, was your motion with or without?
With.
With names.
Okay.
Thank you.
Thank you.
Leaving Julie's name off.
No, she's a
No.
member of the board and she voted for it.
Again, add it, yes.
So Lisa, you will add Julie's name in?
Yes.
Yeah, I'm sorry
And-
for that oversight.
And Julie has a long road ahead of her. However, the letter reads.
Where do you want your name, on the beginning or the end or the middle?
Still traumatized from the last go-around of
I know,
anything.
I understand. And I'm sorry, maybe we should have
But now
found,
the FDA is supporting us, so you know.
Oh, he was supporting it then too, didn't matter.
probably should have found a way to warm me up a little more. I
Next up
apologize
on
if
the
we
agenda
didn't.
is to approve the August 16, 2018 minutes. And it's,
And we'll accept the minutes from August.
Any public comment on the motion? Any staff or board comments on the motion? All those in favor, signal with aye.
Aye.
Opposed? Motion carries. Ellen, update on strategic planning process.
Apologize I couldn't be here. Thank you for carrying, to everyone for carrying forth. I have met with staff, I said repeatedly, looking at what the outcomes are, and we are working on those outcomes and will not, as you probably aren't surprised to hear, have them for today, which was our original plan. But we will have the goals, measurable goals, measurable objectives, and the first year activity, just the first year work plan. It'll be a little shorter activity work plan because we are a third of the way into the year. I apologize for that. We do not wish to have it adopted later than October, so we will do our absolute best to make it, something that you feel you can adopt or with minimum modifications, because we are going into our reaccreditation, and to have it adopted as late as November and to file our documents in December just doesn't read well. So that's my intent. We'll send it out to you, and if you have any major comments before the October meeting, please, and when I send it out, I'll remind you with this message, call me in advance if you would, so that we have a better chance at the staff level to understand and adjust accordingly. And thank you again for getting through.
Okay. Pam, next up is Maternal and Child Health Advisory Council update.
Okay, well, we met last Tuesday, and the updates were that the Neonatal Abstinence Syndrome Group has helped CMC and St. Pat secure grants of $150,000 each to assist in developing a program to improve the care for pregnant women struggling with substance abuse. The program will identify women with substance abuse programs, offer treatment during pregnancy, which hopefully will reduce newborn withdrawal symptoms. And they hope to standardize the screenings that they're doing, train providers how to identify and care for women with substance use problems, and partner with the community organizations to provide addiction services. And there was a nice little news release in the paper. I don't know if anybody has seen it, but we passed around and take a look at it. That I think it was a really nice article about both hospitals and the programs. So that was kind of the big news. And the second one is that there was an increase in the number of drop boxes in the community for unused narcotics, and I only got 3 locations. We didn't have the other 3, but one will be at Curry, one will be at St. Pat's Hospital, and another will be at Granite Pharmacy, and I don't know where there are 3 more, but I don't know where they're located. Also, with the state is requiring the maternal child health department to participate in a pilot program called Connect, which is an electronic referral program where all potential referrals for any services will be in one spot, so that you can just go click and it will send referrals kind of automatically. It'll be for things like CPS and providers and any kind of other services that might be needed for maternal child health issues. There are a couple of things that are unclear about that. One, who will build the referral base, and 2, who's going to keep it updated. So those are issues that have to be worked out before it can actually come into play. And the last one is that the maternal child health services are now seeing all moms at St. Community on 2 days a week, and they are applying for a grant to expand those services to 5 days a week and at St. Pat's, so that they can see all moms that are delivering in the county, in the city at least. So we won't know about that grant for a while, but those were the updates.
Great. Ellen, back to you for director's report and accreditation update.
Okay, well, you may have noticed from the first agenda to this one that when it's marked on here, I removed an action item, which was the approval of the fiscal year 19 cash allocation budget, because at this time last week, not all the numbers were reconciled between the county books and ours, and so I don't want you adopting it. As of yesterday, they are. But I also learned 2 things that could affect the cash budget. Well, one thing I didn't learn, one thing I realized I messed up on. I had not put in the reaccreditation fees that would be due every 5 years, and this is the year they would be due, FY19. So I will have to amend the budget, and then that will change the cash budget. We'll take those from cash in the amount of $12,000.
$12,000.
Yeah, you get reaccreditation
Well, our
every.
numbers came in a little bit higher, maybe you have 12,000 now.
Yeah. Also, thank you for mentioning the other grant about the universal home visiting. We are close to completing a grant proposal to evaluate for expansion and replication and expansion, the foster child health program. And I have my monthly meeting with the commissioners next week. I'll be talking with you about that and be seeing if you'd like to sign a support letter that I'll be writing for you, if you would. And we just learned this week that the long-awaited, it's 9 months awaited, mental health block grant, the reconfiguration of that, that was to have come out first in January and then in March and on and on and on, did come out this week, and it's due the middle of October. It has been seriously reconfigured. It would not be a county-only grant. It would be a grant to take on a region of 7 counties. So it's not looking real feasible for this department, but we do think it's very important that they come to the money and the support come to the region. So that's something else I'll be speaking with the commissioners about. And in the meantime, I will be speaking with at least the mental health center, because it appears to be their region that it's designed for. So.
And they have 17 counties, so they could easily get
Yeah.
there.
Yeah. So we'll have what I think will be a pretty friendly discussion there, because it doesn't sound like we're going to be competing in any way. I think our goal will be get the mental health block grant money into our region so that Missoula County gets its share. So if that's the way it has to happen, we can live with that. That's it. I just want to thank everybody on staff. Did so much to cover me in my absence and keep things going for the last year, and particularly the last week, and I really appreciate it. And apologize for the things that the wheels I couldn't keep turning, but
Understood.
thanks.
next up on the agenda is public comments on items not on the agenda. Seeing none. Next up, forward and staff comments on items not on the agenda. Go ahead.
Oh, I just wanted to let you know what was happening with the Don Larson lawsuit against the county with regard to the Sealy Sewer Board. Last time I checked in with you, there had been a preliminary injunction hearing. Don Larson's counsel was given the opportunity to file some supplemental briefing, which she opted not to do. So she filed a motion to withdraw her preliminary injunction request. The court denied that motion to withdraw because I think the court would like to make sure it is denied. The preliminary injunction itself is denied. So that hasn't happened yet, but that's what we anticipate is going to happen. So once the preliminary injunction is denied, then that means that the lawsuit can just continue without any hindrance on the sewer board as it currently stands.
And what's the timeline on that?
You know, there's no scheduling order or anything like that, and I'm not familiar with what's happening with the board, but from the litigation perspective, I think we anticipate that that injunction motion will be denied any day.
Okay.
So there's been a second one filed though with more people's names on it.
A second.
Same
Injunction?
thing.
Lawsuit, yeah.
Oh,
Yeah, Don Larson signed, now he's got 50 people signed on,
Yeah.
including the board member who resigned.
Mhm.
against the
It's the same story.
Yeah.
the county and the board? When was that filed?
A week or so ago, John told me about it.
There was an article in the Pathfinder
Oh.
about this.
Unless it's part of the
It
same
has,
suit.
it has no new facts or anything, so, yeah. So
I was heading for a
that's where I'm
second
headed
denial.
tonight, is to the Sealy Sewer Board meeting, and there's a lot of jockeying going on right now about whether or not, if there are only 2 people there, nothing can happen. So the one other board member's trying to decide whether to go or not. If he goes, can he get the other, anyway, it's just a mess. It's all politics. I did want to, however, thank Shannon, and she isn't in the room right now, but she, of course, has been working with DEQ on some potential legislation, and so she really helped out with the MACO resolution that we had in regard to being able to use junk vehicle money for extra junk vehicle money, not to steal away from what we already do, but for mobile homes and old campers that get left laying around and nobody has the responsibility or money to fund that. It sounds like DEQ has a proposed legislation coming forward on their own that we can just tag on to, but she was really helpful with that, so. And sat in on the committee meeting and helped us wordsmith.
Yeah, she actually enjoyed the MACO meeting.
Oh.
Can you remember last time you enjoyed the MACO meeting?
There were good parts.
Yeah. And I just want to make sure that the email I sent yesterday that has the Calumet court order, okay, you all received that, and so we'll put that on the agenda for October.
Okay.
For that litigation.
With that, we are going to adjourn temporarily from the Board of Health and reconvene as the Water Quality District Board, and we have minutes from July 19th to
So they just remind me that the commission did hold a hearing and did raise the fees for the Water Quality District, which is in our budget.
Oh, yes, thank you, just in time.
Yeah. So I would move that we accept the minutes as presented.
Any public comment on the motion? Any other board or staff comment on the motion? All those in favor signal with aye.
Aye.
All those opposed? motion carries. Next up is Travis.
And he
He's out
he's
there. Oh, she did.
skipping.
Update on the berm stability study for the Smurfett Stone site. Yes, it's your turn.
Great.
That was just in time.
Okay, just in time. So I wanted to give you a quick update on what's going on with Smurfett Stone, and I apologize, should have had this thing up. But so the berm study, the berm stability study was completed last month, and August 13th that came out. And in it, the berm, you know what, I'm just gonna talk. So they identified a couple of things. They did a couple of different analyses. One is called a seepage analysis, and this is at Smurfett Stone, so we're talking about approximately 2.5 miles of berm. These berms were designed to hold wastewater on the site. They weren't designed to keep water off the site per se. These were to hold back water until it could be discharged directly or infiltrated into the ground. And so this analysis was something that the board had asked for last year through what was called Addendum 9, asked for a thorough evaluation of the berms. And what they did is they looked at 3 different failure mechanisms. One was a seepage analysis, so how water can be transmitted both from the riverside through the berms to the on-site ponds, or vice versa. And they looked at that through using borings through the berm and soil test pits, and then found that the modeling showed failure in a couple of spots. One around Pond 2, which is the most upstream pond, kind of makes the river makes a dog leg there during high water. And then Pond 13, where we saw the tea-colored water actually earlier during the flooding this year. So it was also analyzed using a slope stability analysis. So if the water comes up and drops fairly quickly, it can cause some instability in the berm. And that modeling showed failure again at Pond 2 and Pond 13, where we happened to see problems during high water. The other evaluation that was done is a berm overtopping analysis. So that's the most simple view of I guess a berm stability study is looking, okay, at 100-year flood elevation, would this thing overtop? And again, these weren't designed to be impermeable from the river. So that analysis, which we anticipated would not be the most likely failure analysis, it showed 4 to 5 feet of what we call freeboard. So 4 to 5 feet before it would be overtopped. Of course, we've still got slope stability and infiltration issues. The things that were missing from the study, really the biggest concern is what the hydraulic forces of the river itself could do to the berm. Just the movement of water itself, what it's called a hydraulic analysis. That was not done. So we have components of the hydraulic analysis, including that seepage and that slope stability, but we haven't seen an actual analysis of, yeah, exactly. So that was probably the biggest shortcoming of the study. In addition, the inner berms, so there's the outer one, and then there's a network of internal berms. Those weren't evaluated for any slope stability or seepage analysis or hydraulic modeling. So the commissioners noted that as well in their letter, and the advisory council wrote a letter as did the water quality district. Another issue which this board's may be familiar with, a few years ago, the water quality district commissioned a channel migration zone analysis on this section of river. We feel it should be done again, and we're working on trying to find sources of funding to get that done. But that's another potential mode of failure out here. It goes hand in hand with the hydraulic failure, but where the river might want to go in the future. Another issue is, so you've got 100-year floodplain elevations, which are determined by FEMA using gauge data, and they set a flood elevation. So at this part of the river, maybe the flood elevation, I can't remember off the top of my head, but say it's 3,170 feet. That is the 100-year flood elevation. That study was done in 1974. Since then, we have, 46 years of data, of USGS gauge data on this river, and the river itself has moved around. So we really think that the stakes are high enough here that they should go back out and look at the cross-section of the river, the geometry of the river channel itself, to determine what exactly is this 100-year flood elevation. It's being depended on for these models. It should be pinned down pretty hard. So those are the high points of the berm stability study. We're glad they did it. We think the methodology in general was good. They used a good number of test pits and bore holes, and they took we used River Design Group out of Whitefish to help with the commenting on this, and they took a lot of those recommendations, but there's still some gaps that need to be filled. Next, so for the Water Quality Advisory Council, that took up a lot of the discussion this a couple of weeks ago now. The other thing that we discussed, so the EPA and DEQ have been invited to come to the next advisory council meeting and talk about some more technical details about this and other sampling issues on site. So they have accepted that invitation and will be at our next meeting. So the advisory council is coming up with a list of questions to make that time most fruitful discussion. The other thing is we have Household Hazardous Waste Days coming up this weekend. So if anybody wants to come and join us, we're always for extra hands, but we'll be anticipating a big crowd this weekend.
And just for the public, Travis, why don't you tell everyone where it is?
Sure. It is on Scott Street, 1305 Scott Street, on the north side where the city shops are and Zip Beverage. And it's a 2-day event to collect household toxics, mainly flammables, but pesticides and other toxics, and get them disposed of properly. We are working on a permanent solution to household hazardous waste, but in the meantime, we're going to do this 1-year event, which we've done before. So if anybody's interested, they can swing on over to the front desk and get signed up to help. So.
And clean out your garage.
And clean out your garage? Yeah, that's right. That's right.
I have a couple questions going back to the flood study. So is a request going to be made to DNRC to look at a refresh of the FEMA firm for this reach? I mean, a lot of things have changed. I mean, there's a dam that's not there anymore.
Yeah, exactly.
So, I mean, is this on DNRC's radar to refresh the flood study?
So DNRC is doing their own review of this berm study, and this may be a recommendation that they have. We made the request to EPA for the potentially responsible parties to do that hydraulic analysis. But I suppose it could get a letter of map revision or sort of official designation.
Yeah, I mean, normally DNRC is taken in big reaches, and just to take that discreetly, it could be done, and do a LOMA or something like that, just discreetly, Smurfit Stone. But it occurs to me that the stretch of river, downstream of there to upstream has had significant change since the last official firm, and that it's probably worth you know, DNRC thinking about.
Because we know in the Tower Street area, for example, it'll now flood at 7.5 feet instead of 10.5, so there's been a lot of change.
Yeah. And then going back to the overtopping study, there's 4 or 5 feet of freeboard at 100-year base flood elevation. And were any base flood elevations above that considered, or just 100-year and call it good?
It was just 100 years, so that was some additional comment that we had, is looking at what event would actually overtop that.
Yeah, exactly. I'm wondering that too. And then on the failure modes, you know, from the river into the pond, was that, I mean, was it just the 100 that was looked at, or were you looking at 25, 50, 100-year events? Just the 100?
I think it was just the 100, and so they come up with a scoring at each station for the failure mode, and I believe it's just a 100-year flood that factors into that scoring. So, you know, a passing score would be like 0.5 and above, and so several of them were like 0.49, 0.47. They're close. Yeah.
Yeah.
They're close, but I think it's a 100-year event that they use in this. It's a Corps of Engineers model.
Sure. I just was wondering if there's a rating curve for how the different storms come through and if the shear affects the failure, but it doesn't, just looking at one.
For the slope stability and the seepage analysis, what I saw was just a 100-year event.
Okay. Okay.
It might have been buried in the appendices that I didn't see, but.
On page 580,
Yeah.
you weren't still awake.
Right.
Okay. Great. For the Water Quality District Board, are there any public comments on items not on the agenda? Any other board or staff comments for the Water Quality? Okay, we will adjourn and reconvene as the Air Pollution Control Board. And we have minutes from July 19th. Thanks, Charles. Or I add them. I don't know if I did. Those are short.
I'd move to approve the minutes as presented.
Any public comments on the motion on the floor? Any board or staff comments on the motion? All those in favor? Aye. Any opposed? Motion carries. Because I think that Sarah's on her way, I might just go on to the update on the TPCC. We met on August 21st. It was just really to ratify a couple things that we had been looking at, which was Amendment 2 on the Long Range Transportation Plan. And it's interesting that transportation is actually like a little bit behind like health, you know, issues where all of the goals are based on, you know, outcomes and evidence-based. So interestingly enough, transportation performance is moving that same way, and so it was just to get these elements of system performance reporting in there, just, you know, evidence-based things, not just like, oh, it seems like I can get to work faster. So it was that was that amendment, and then looking at the work program elements that are planned for the 2019 Unified Planning program under the MPO, and those were approved. So that was that was sort of the update. I think we had a couple of things. These things have now passed, but bike and ped counts, the hand counters will be out again because we need to get some data to support ongoing work, and I'm just looking through. I think that I reported on this before, but for anyone who's now used it, the first bike, you know, purposeful for bikes crossing
By the mall.
Yeah, is up and running. So for those of you who ride the Bitterroot Branch Trail, to hit that, and it's designed for bikes, so I think it's really cool that we have it here. So that was the update. I guess there was one other thing that Shane Stack did relay, that the trail at Russell, the construction of the underpass trail at Russell Street is behind schedule. So if you were aware that there was a proposed date for that coming up, that will slide and be pushed back. So he didn't have a firm date based on updating construction schedules, but that is ongoing, and they are working really hard to get it open. But it's
How
delayed.
far?
I think
Spring?
like a month. No, I did not feel like that, but
Okay.
but
They're pouring the retaining walls now to get to it.
But I think it was like supposed to almost be open now, and I think they think maybe November-ish. So
I think it's obvious the whole thing is a bit
behind
behind right now.
Well, some parts of it are, but.
For 2
Like
decades.
they're ahead of schedule on their paving, because they're gonna pave the whole street instead of just half.
Considering it's been 20 years,
yeah, I know.
it's great.
It's awesome.
They're gonna
It's
pave the whole
happening.
street instead of just half? Well, that's cool.
Yeah.
It took me a while to get that.
Yeah.
Well, they were-
because they've got curb in both sides.
Right,
just-
they were just gonna do half because they're only doing one piece of the bridge.
Okay,
Yeah, no, it made sense.
I know, it's just,
temporary.
yeah.
Yeah, so that was it for TPCC. So
And
Sarah's here now.
Next month we meet,
Joint, yeah.
jointly with T-TAC.
There was no meeting last week because we are meeting joint with T-TAC to go over some things together on, I think, around October 4th. So
And it's related to bus, right? I think it's related to MUTV's plans. So we'll pitch again, that the bus should go by this building.
Partnership
and
Health
PhD.
Center. What does it take?
A lot of pressure.
It is.
We'll try. Sarah's here now, so we'll get update on wildfire smoke. I think preparations. That's in the agenda, but just, yeah.
So this was a extraordinarily mild wildfire smoke year for Missoula. I was saying going into this season that we're counting on luck because everything was going to be super dry, and we got lucky. There was very little lightning really, and anything that did start got stamped out really fast by our responders. So it was a nice break compared to 2017. This year, from wildfire smoke in Missoula, we had 2 exceedances of the air quality standard. Those are both in August. And then I'm sure those of you who were around a week or 2 ago remembers the smoke we got from prescribed burning in Idaho, which caused 2 more exceedances of the air quality standards. So that was unfortunate, and the state is working up a package to give to EPA to hopefully have those expunged from our official record if it comes where we would need that in order to stay under the NAAQS with our design values. So EPA won't really look at that unless we're close to exceeding the NAAQS, but they're at least trying to prepare it. One of the tricky things with that is for a prescribed burn to be counted as an exceptional event, it needs to have been done using smoke management and just basically be betrayed by meteorology, which happens. But Idaho doesn't have a smoke management plan, so we aren't really sure what's going to happen. So that's all being taken care of at DEQ. So we will see where that goes. You may have noticed that there's a fair amount of prescribed burning going on right now. There's conditions are decent for it, and so they're out there doing a lot of understory burns. We did nix a 1,000-acre burn that was proposed for 40 miles that direction tomorrow, and we're like, no, because that would have sent, the Weather Service put out this really good description of what they expected the smoke to do, and the smoke was expected to just come and land in Missoula tomorrow night and stay until the middle of day Saturday. So that one is not going to be approved until there is really fantastic east winds to take the smoke to Idaho, which seems fitting. So aside from what's happening with smoke, we were trying to do our best to be really prepared for wildfire smoke this year, and we will continue to try to stay ahead of wildfire smoke in the years to go, with the goal of becoming a community that is ready for wildfire smoke, because as I think we're all really quite familiar, there's going to continue to be wildfire smoke. That's just the trend that we're on. We got lucky this year. A lot of communities outside of Montana had terrible years. It's just, it will come back to get us. So right now, our current strategies include a cache of portable air cleaners with HEPA filters in them that we purchased last year with Sept money, and then got the grant from the Disaster Relief Foundation. We used that to refund some of the Sept money, and then also purchase additional air cleaners. The remainder of that will go toward replacement HEPA filters. When I went through and was doing maintenance on the ones we had in City Lake and Lolo last year, I just had to throw those HEPA filters away, because when you plugged it in the machine and turned it on, like smoke smell just poured out of it, and we're like, I cannot give this to a daycare. So I had to throw out the last year's used filters and wipe down all the machines to get them to be less filthy. So that is, we're going to use the remainder of the grant for more of the replacement filters, and then talking to Adrian Beck at Office of Emergency Management to see if we can't, there's a FEMA grant coming in for like wildfire mitigation that's really focused around landscape treatments and hazard reduction around homes, but there's a part that's vague enough that we're going to try to fit into that little portion of the grant and say part of preparing for wildfires is preparing for wildfire smoke, and see if we can't get some more money to come in for what we're trying to do that way. So we have our current cache, 123 of these air cleaners. Climate Smart had several going into this year, and then got a deal from Winix on some more, so she's bought like 60 more this summer. And we reached out to all of the licensed daycares and preschools in the county and said, hey, we have these, we want you to have them before the smoke gets here. We had pretty good response, and anybody who asked for them, we were able to get them as many as their facility needed. So between the two of us, two of our organizations, we covered 32 facilities covering over 500 children. So if we had a smoky year, it would have been more like, yay, look what we did. But it's good we didn't have smoke, but we were trying to be ahead of the curve and prepared for it. We also spoke with some groups that maybe didn't fit into that specific category, but still needed a way to clean their air. So I was contacted by Potomac School through Public Health and Human Services to me about a special needs child coming in that just can't have any air pollution exposure at all. And so I was able to direct them back to Climate Smart because they're giving theirs away. So they were able to set Potomac School up with enough of the air cleaners to keep the air clean in every classroom that child will be in. And then the special education co-op preschool is part of MCPS, so it wasn't on our initial list. They have special needs children as well, and so we were able to get them some permanently through Climate Smart with their, they're just giving them away, which is great. And then Climate Smart also gave some to Rattlesnake School to follow a child with cystic fibrosis around. So she will always have a cleaner in her classrooms. So we're doing that. We met with MCPS to find out what's going on with all of their school remodels, what they have in their schools. Climate Smart received a grant for $5,000 from United Way of Missoula County this summer to do a school needs assessment, which is something I really wanted to do, but just did not have time to do. And so I'm working on that document with them. They got information from all the public schools in Missoula County, what the filtration ability is in every school, what their remodels are going to have, how many classrooms they have, how large the classrooms are, and then just kind of like a list of recommendations for what those facilities can do to try to provide cleaner for their students. We wanted to have this because last year what we ran into was parents coming and saying, hey, why not my school? Why doesn't my school have anything for me guys? And we're like, well, City Lake and Lola are being hit really hard. We can't do all of MCPS. We can't do all of Elliott. We just can't. But now we can at least say, hey, this is a step you can take. And this is, how many air cleaners you would need to clean your classrooms. And so it's a step in the right direction toward getting that point. One of the things that really stuck out to me going through this report that they've been putting together with us is the remodeled schools before 2017, their maximum MERV rating on their filters was 8, because that's what the association that is in charge of HVAC systems requires in a new commercial building is a MERV 8, which is a filter that is not rated for cleaning by particulate. After 2017, when we started getting involved and the schools would come through the health department for some of the checkoff, because they have to be able to show they're providing a safe environment to their kids, Michael Dorshorst in licensed establishment intercepted every single one of those and said, hey, we need to talk about your MERV rating. And so after that, every single one of the new schools and all the remodels are rated under at least a MERV 13, which is rated to remove some fine particulate. And Hellgate, I think Hellgate Middle School is like, we'll do a MERV 14. So we're seeing a change in the schools themselves with what they are planning on doing. So that is great. And then the other thing that we did this year was more for outreach. So I had a column right in the Missoulian with advice for how folks get ready for wildfire smoke, and much longer and chattier blog posts for people who are on my distribution list and go to our website. And then next week, I'm giving a Hot Topics in Public Health webinar through the Northwestern Public Health folks at the University of Washington about what we went through in 2017 and what we've learned from that, what we're doing now, about trying to create smoke-ready communities. So that'll be neat.
Nice job. That's simple. I have one other question that would normally be done, but I'm afraid you're going to run out the door. It just occurred to me that it's been a while since the district made application for removal from non-attainment. And I know that it could take forever. So are we just in the forever phase?
We're in the forever phase. They were hung up on looking at it by 4.112. If you remember, we brought that to you in its newer version a while back. And then what we ended up doing about a year ago was saying, hey, never mind, take this out of consideration. We took all references to PM 2.5 from Chapter 4 out of our SIP submittal as part of that that submission. So they technically have like 18 months after they receive it to look at it, and but they expect it to go through. They don't seem to have any concerns. They did actually reach out to me this summer and say, hey Sarah, it's been a long time since you did this emission inventory, and now it's a 2010 emission inventory, and really, why don't you true that up for us? And I wrote back and said, no. This is, I called him, I was quite upset, because he was like, oh, just change a few numbers. I'm like, you don't understand how much work goes into putting together an emission inventory.
That was our fear.
It's not just a computer program that I tweak a few numbers. Like, you have to do a lot of work, and it's not my fault that they got hung up. Anyway, then he looked at it, he read it, he's like, oh yeah, no, never mind. That is a lot more complicated than I thought. We're good. So that is good news. Okay. Because I did not want to redo that emission inventory. It would have been
bad news. Those are the people in charge.
So they are looking at it. What that means is they are actively reading it. They are looking at it, and hopefully it will be completed soon.
When is the 18 months up?
I don't actually have. I don't know for sure because we.
Don't know when the time clock started.
There's just so much, so many steps that got forward and backward, and
Okay. So. Thanks.
Yeah.
Next up on the agenda is public comments on items not on the agenda for the Air Pollution Control Board. Seeing none, any other board or staff comments for Air Board? So at this time, we're going to reconvene as the Board of Health, but we are going to go into a closed session. So, at this time, we'll all those in favor?
Aye.
None
I don't
opposed.
waive my right to privacy anyhow.
And then Julie, you'll take separate closed meeting minutes?
No, she usually
No, I
doesn't.
step out as
Okay.
well. So, one quick question.
Yeah.
Do you want to allow Mary to go ahead and take down
Yeah.
all of her
Yeah,
stuff now?
and
not
then you'll
have
just
to
come
wait?
back because they have to
Right.
take action
Yeah,
in
thank you.
open session.
So you don't want that recorded?
Yeah, we're
No.
just gonna discuss, but they'll take action in open session.
Yeah, we will open it back up and we'll see if anyone